everybody, and we're back. All right, so going through Brian's story, what he deals with on a normal basis with panic disorder, anxiety, depression. Want to remind you guys that this is just his story. It doesn't mean that it's right, wrong, or indifferent. It's what he goes through. We are not giving medical advice. We are not telling you that you need to do it this way or that way, or this is how it should be. Also, this is probably not geared towards kids. He's very vulgar. So if you're going to watch it with your kids...
The fuck did you just say?
Language. See? There you go. Please keep that in mind.
Yeah, I don't smoke, drink, or do drugs, but I curse a lot, so get over it.
There's going to be some adult content in here as well. Also, if you get offended easily...
There'll also be some juvenile content.
If you get offended easily, you might not want to watch this. But if you are enjoying what...
You definitely don't want to watch it.
If you are enjoying the episodes, please remember to subscribe, and you can ask questions in the comment section, and we'll get back to you.
Just try not to keep them normal.
This is coming from somebody who said he wasn't normal. Okay.
Well, I'm not normal, but don't ask stupid questions.
You can ask whatever you want. Just ignore him.
Everybody else does.
We'll be touching base on a lot of different things, but right now we're just covering his story with the panic disorder, the anxiety, and the depression. So the last episode that we had finished, we were talking about the what if thinking. He suffers from what's known as what if. What if this happens? What if that happens? Or
I don't know if that's a legitimate medical term. You got the what ifs. Well, what it all started, I mean, that was going on before.
Well, I was just about to ask you, do you remember when you remember it starting?
I mean, it was shortly after the panic attacks, or just the constant state of panic and high anxiety. That also with the digestive issues that came along with it. So there would be that, what if I go to the mall and I have to leave? Or what if we're out here and can't find a bathroom? Or what if, so that was early on, but it didn't, I would say late 90s, from when it started in 93 into the 2000s, it may have been prevalent. But I think it had, with getting involved in a lot of other stuff, you don't have time to sit around and think of that stuff.
I was just going to ask you, do you think that if you have free time, it's your head, it's your mind going do. Rather, if you're busy doing something, your mind's probably still going do, but you're not noticing it as much because you're busy doing, you're occupied.
Well, there's a difference between what if and my mind just going. What if is me honestly sitting there consciously going, well, what if, whatever. Other times it's just, or all the time it's just.
They go together though.
Everything. Not necessarily.
Well, that's what, so the doctor I had spoke to, that was one of the things that we had talked about, because
right now I'm not worrying about what if, but my mind's still going.
Right, but
I know that, like, the motorcycle's getting picked up, and did I get everything done and ready for it? And, it's...
Continue that part. Did I get everything done that I needed to? What's the sentence going to be after that? What if I didn't? What's going to happen? So, yes, it still has a what if component to it.
Yeah, I mean, I don't know. To me, it's...
Your what if thinking is more like, what if I eat this and it's bad? Am I going to get sick? Or what if I get a flat tire in the middle of the night out on the road? That's what you're... But other things... As long as that isn't shutting off, you're going to have the what if. It might not come in the form of what if, though. well, I got to do this, but what happens
Yeah,
if
but I
that?
still separate the two of them.
But okay, I understand you separate the two, but when it comes to
There's that, I can count the times on one hand that I'm, even when we're sitting here watching a show, my mind is still thinking of what I'm going to have to do this week, whether it's a doctor's appointment or I got to go here or I got to pick this up or I got to do that or whatever. My mind is like, that's why I don't make appointment. Like, I try to make one appointment, get that done and whatever. Because if I have three of them, then I'm thinking about all three of them.
and what do you think about the appointments?
Just making sure that I'm going to be able to get there. What if there's a problem?
There you
Yeah.
go. What if my stomach starts? What if I don't sleep? What if I see what you're saying, but it still triggers that.
Yeah.
What? And so
You're right.
I didn't realize until I talked to her about it that it goes hand in hand. And she made a really good point. She goes, stop and think about it. If you can quiet the brain down of not going, like firing off left and right, you're not going to be asking yourself these questions, what if, because your brain's not firing off of everything. It actually kind of quiets it down. So
I don't know that it would do away with it completely.
no, not completely, but it does say if you, I'm just giving numbers, say if you're at 100, it may quiet it down to 50, 60. It may, and that would be a significant change on somebody who's constantly going do with, and I did not realize until we were talking and she said it goes hand in hand with ADHD and ADD. She's like, stop and think about it. What do kids with ADD do? Constantly twitching, constantly moving, constantly doing something. She said a lot of times it is also internal. So the brain's constantly going. And after she said that, and then I thought of the big picture, and then I thought of you, and I'm like, poster child.
Which will lead us into in 21. I think it was 21 or 22. My mom was still alive. I know that when I got the what they call a neuropsych exam, which is basically a 4-hour, you know, interview, and then
They do some cognitive testing.
verbal and written testing, and then they spit out, anything and everything. I know they, at the end of that, once they wrote the report and sent that, it was panic disorder, depression, anxiety, PTSD, possibly ADD, but the test didn't really reveal.
And it's hard. And she did tell us that it's very hard to diagnose an adult with it. It would have to go back to your childhood.
Bipolar personality disorder.
They go to bipolar person. It's the
They had them listed in, comma, this kind of borderline personality disorder. I'm like, you call me a mass murderer?
No, I think what they do is they say,
and there was something else, which I was just like, all right, well, half of these are complete horse shit, because I've looked up the symptoms for half of that stuff and has nothing to do with it.
So,
especially the PTSD.
What they say is if there's a number between 1 and 10, and if you score 4 to 10, you could possibly have traits of this. Well, okay, but at a 4 and at a 10, there's a huge difference. And 4 on this can mean this and not that. That's the problem with those tests.
Well, that doctor's job was to just do the test, spit out. I mean, it's kind of like the person that reads your MRI or a CAT scan or whatever. They put down everything that they see, even though that 80% of it is completely irrelevant and is benign and has nothing to do with anything.
I agree with you to a degree, but the part I'm disagreeing with is that was her interpretation of the interview she did.
Well, with psychiatry or whatever, that's all any of it is someone's opinion.
So correct. So you have someone's interpretation. So if you took three doctors and each three of them gave you three different things, which is very common when you do like MRIs or CAT scans, three radiologists, three different readings. Unless you have like a massive mass that sticks out. Someone might pick up this, someone might not pick up that.
Yeah, but it's not the same as you take blood work and the blood work comes back and it shows it or it doesn't. With psychiatry, I could probably go to 10 neuropsych exams and every one of them would have different stuff down there.
So how do you know how to treat what you need to be treated for?
How the hell would I know?
Well, that's what I'm saying. Like,
I got kicked out of high school. I don't know. I'm not the one with all the letters behind my name, except GED.
so they don't go behind your name. Anyway, so the what if thinking when you had the neuropsych test done, and unfortunately, we haven't been able to follow up with it because getting in with somebody that actually
Yeah, it's been 5. Yeah, I was in 21 because it's been 5 years
does
of
right.
trying to get in somewhere that either diagnoses or,
knows how to interpret them.
Now, this is where I'll also, and you'll hear me from time to time just bash the medical community because I can't really stand it for the most part. They'll tell you that they do it. And then when they start making the appointment and you actually talk to one of the therapists or whoever, oh, you'd have to go to here to do that. And I'm like, well, okay, you just wasted 3 months. So now I got to go find something else because,
Unfortunately, that's common a lot of times. And it's not just in the mental health, it's a lot of different things. So
but as far as the what if, like I said, that's, been since the, 93. It seems to have gotten to the point over the past maybe 4 or 5 years. It seems to have gotten worse and keeps getting worse over the past few years. Now we're going to start talking, or I'm going to start talking about some stuff that is going to seem really psychotic to most people. And this is what I deal with on a constant basis. And and I've had doctors go, that has to be, it has to drive you insane, like thinking like that. And I'm like, well, it's gone past that driving insane part, and it's just how it is. Because that's how I have to, especially right now with like food is like the big thing.
It's not that you have to, it's how your brain is making you. It's not, if they can turn around and say,
well, I do have to. What choice do I have? Because, and I don't want to hear anybody with well, just don't think like that. Thanks. I didn't, I should have thought of that, and I wouldn't have gone through the 30 years of dealing with this dumb shit. It's, everybody thinks the way they think.
Correct.
Whether it's logical or not.
But my question would be, it's illogical.
And I still can't.
Right. So there has to be, so that's why I'll say, and I've said it to you numerous times, and I'll say it until I'm blue in the face, it has to be a chemical imbalance in the brain.
I don't know what it is, and until I can ever get somebody that'll actually get up off their ass and do their fucking job.
Well, you can't say that because
I can say that because
you can't.
What mental health professional has done shit?
The ones you're looking at can't, but there are, and this is where
it's not the ones I'm looking at. I go down the entire list.
No, you won't. No, and this is where we're going to get into a little bit of a heated debate because because of the what if thinking, it limits you to where you can go.
Okay. Well,
So you can't sit there and say no one's doing their job.
Before okay, the ones that I talk to aren't doing their jobs.
If that's not in their scope, how are they not doing their jobs?
Okay, first of all, here's where we're going to have a problem, and anybody that's listening that you may get offended at this one. The real woke shit that's going on since COVID is what's holding me back from being able to get anything, because I don't have any of the shit that these people are claiming.
That didn't answer my question.
Or I'm getting there. Or what is popular in psychiatry right at the moment. So it's limiting me to where I can get help from. And you know this because we've had these conversations.
But even the other ones that you were talking to, they couldn't do the neuropsych eval. So you're saying that they're not doing
because they're too busy doing dumb shit.
No, it's not in their scope of practice.
If you have a psychiatrist or a psychologist, it's in their scope of practice.
Not necessarily.
How do you not diagnose a mental illness if you're a mental health professional?
They can diagnose a mental. It does not mean that they are going to interpret the neuropsych report.
They don't have to interpret the report. I can read the report and interpret it. I've already done that. All they have to do is sit down and talk with me over months to see if I have any of those conditions.
Don't mention the neuropsych test to them at all, and just go and have the therapy and see what happens. I think that's where
that's where I've been. I stopped mentioning it 2 years ago. I don't bring it up anymore.
Well, it hasn't been 2 years, but okay.
Well, however long it's been, I don't bring it up.
Because
I stopped saying it. You said, don't tell them. Okay, so I stopped telling them. It still didn't get me any closer.
And the other part is, and I'm not faulting you at all, is you can only go so far. Like we had the one,
agreed. There's, but then we also get them where a lot of the places now are a call center that is basically a contractor,
right.
And they subcontract or independent contractors that are the therapist. So they don't know if that therapist takes your insurance or not. So they book you, you start talking to the person, they go, oh, yeah, I can't do that.
Or they're waiting to be cleared through the insurance.
There was one facility that's in the county that takes the insurance. The same company doesn't take it in the city, and they put me with somebody in the city who doesn't take the insurance. So that's the stupidity that I'm dealing with.
Okay, so I think that
stuff becomes frustrating to where I don't want to be bothered.
I get what you're saying, but, and this is because I had the background in that area. The physician themselves, whether it's a mental health provider or a medical provider, whichever the case is, they're the ones that are insured. When they say the office takes it, if they have multiple people in that office, I'll give you an example. I just went through with it with ortho when Trevelyan was out. She hasn't got approved for that insurance yet.
I get it, but it's just fucking stupid. You're just wasting people's time. Take it off your damn website.
Because there are doctors that take that insurance in that practice.
It's still fucking stupid.
I get what you're saying.
You're literally making people who are already sick or need help jump through hoops or have to lie. Because I'll tell you right now, the best way to get any kind of health care, lie your ass off about whatever is going on at the moment.
Oh, yeah.
And you'll get in a whole lot faster. But back to the what if crap. So, yeah, can I pinpoint when it started getting a lot worse? No. It's hard to pinpoint anything anymore. It's after COVID, but it didn't have anything to do with COVID.
Right.
Because I honestly didn't give a shit about COVID And like the lockdown part was, to me, was great. I didn't bother me at all. And even for a year, almost 2 years, it just didn't affect me. What started to bother me was when shit started to come out of it. And yeah, around here, it was over 2 years or more before things started to get somewhat normal. And then things that had closed down, like shit that was open 24/7 that no longer is.
Right.
Stores that opened at this hour now open later, close, all that crap.
I think part of it too is after you got diagnosed with the blood disorder, and not the blood disorder as much as the treatment with the anemia or the low iron, that the fear went in is what happens if I get sick. You always had the food issue, but then it was
Oh, we haven't talked about the food issue.
if I'm around anyone who's sick, am I going to get sick? Or like,
Well, it's not so much getting sick, but I don't know to what degree is it going to be.
that's what I mean.
Like a regular cold, I don't care.
But I mean, that's
I mean, I get sore throats, you know, like when I did get COVID in 24, that was that razor throat variant or whatever the fuck they called it. I didn't give a shit about any of it except I couldn't even breathe without my throat. It was the worst sore throat I've ever had in my life. And then as soon as they gave me the steroids, it was gone and I was fine.
And on a side note, I do love him, but when he is sick,
I'm a baby.
oh my, he's
Well, I mean, they don't call it the man flu for nothing.
there's not a man flu and a woman flu. It's a flu. Just suck it up, Buttercup. But yeah, he's and it's most men. I'm not bashing him particularly on this, but it's he's
Yeah, I want to curl up and die and everybody leave me to fuck alone.
yeah. But and I say this in all loving, he whines when he really doesn't feel good. And again, it's not just you; it's most men. So, and I think he just and I don't know if
Well-
you've always been like that or
Probably. But I also hadn't been sick until I got COVID in 24. I hadn't been sick for 7 years.
it probably had been a long time.
Like, not even a cold, nothing.
And it's crazy because when I got real sick with the pneumonia, the bronchitis, and all that, you didn't like.
Well, I wasn't having the blood treatments and
Yeah,
stuff at
that's
that
true.
point.
Yeah, and that was
Because-
months.
When I got COVID, that was in August of 24. And then when was it, the passing out? Was that in January of 25 after we were married, or was that in 24?
It was after we were married.
All right, so that was then. And then I got sick with the head cold really bad a couple months after that. So I was sick like 3 times in less than a year, which was weird for me. Yeah, I can't put my finger on when the what if started. Now, one big what if was always food. Which when I had gotten sick, prior to if you've been following us, about 6 months prior to, or 5 months prior to the panic attack starting and the constant state of anxiety, I had had some digestive issues where my diet sucked. I mean, I was just eating pizza shop, cheesesteaks, burgers, pizza, inside outs, drinking,
Mountain Dew, I believe it was.
a liter or 2 liters of soda a day, and that was pretty much it all the time. So, I mean, it's not a surprise that you would end up with digestive issues. Now, once you eliminate that stuff and you still have them, well, then there's something else going on.
Well, how long were they eliminated for when you, like, how long did you give your body to get rid of everything?
I still had them 20 years later. I still had to.
But your diet sucks.
No, even when I, yes, when I was eating better, did it improve somewhat? Yes, but not to such a great degree. Right now, the digestive issues are almost non existent. And my diet is garbage. And by garbage, I mean like cookies and milk twice a day. And then, like, we just had mozzarella sticks. And then, I might have a turkey and cheese sandwich. And that's it for the day. So you would think somebody who's eating that should have some digestive issues, and I really don't. That being said, tomorrow I'll probably be a mess. But, okay, so the food thing. So what I started doing was I started eliminating anything and everything that I thought may be causing the problem. So, like, what I could, find out from the doctor that I was talking to at that point, it was like, okay, I got to cut out the salami and sausage and pepperoni and, the grease and that stuff. So then I start thinking, well, just processed meats in general. So hot dogs, sausage, kibasi.
Okay, so let me ask you a question. When it didn't change when you cut that out, why didn't you reintroduce it?
I don't know.
Okay.
I just kept. So then it was like the soda was. I haven't not had a soda since '93.
He actually took a sip of my
Vanilla cream.
vanilla cream.
I didn't drink it.
He switched it in his mouth and then he spit it out.
I just wanted to taste it again. But I don't miss it.
So, but
Now, hot dogs, yeah.
should have got you that shirt.
I like a good hot dog. And not with ketchup. Anybody that put ketchup on a hot dog should be thrown out of the country immediately.
So, but if I guess that's my thing. If you cut all that out and you were still having problems, what is the?
Well, it just went from. So that was the immediate stuff because that's what I was eating the most, and
Okay.
even like pizza sauce and gravy out. Which the weird thing was, I didn't cut the dairy out, which is one of the main things that would cause digestive issues for a lot of people. And I was like, that is not getting cut out. Like I eat way too much. Like if I cut dairy out of my diet at this point, there wouldn't be much left except like cookies and donuts, maybe some bread.
So,
But yeah, and then the soda went. All processed meats went. Like I didn't eat lunch meat anymore for the longest time, and even now I'll still only eat like turkey and ham.
yeah.
That's it. I don't eat bologna. I don't eat salami.
And it's crazy because I love salami.
Whatever I mean, yeah, I used to eat liverwurst sandwiches. You couldn't pay me to eat a liverwurst sandwich.
I
And
guess.
I'd probably be fine, but I wouldn't do it.
So that I guess I'm going back to that question though. If you took them out,
Kind of craving a hot dog right at the moment.
if you took them out and it didn't change anything, why didn't you start to reintroduce them?
Well, at that time, you're talking about it's just one big cyclone of bullshit. Not getting any treatment, not getting any help, not getting much support. and dealing with all of this stuff and the panic attack, all of that together. So again, not thinking rationally. And I'm 23. So
So,
I don't know. 23-year-olds don't know shit.
so as time went on, why didn't you reintroduce anything?
Some things got reintroduced. The lunch meat, ham and turkey, because for the longest time I didn't even eat that.
And he does eat gravy.
I went back and started eating pizza, and the spaghetti and meatballs. But
Yeah,
and even like cheesesteaks were out. Fast food. I haven't eaten fast food literally in, what has it been, 33 years now?
no.
93 to, no, I'm saying 93 to 2026. That's 33 years.
Yeah, but you had it once at the pool.
I'm saying in 33
Oh.
years, I've had Wendy's
Yeah.
once since that happened. Now, was I a big fan of fast food to begin with?
Well, we've done Chick-fil-A like twice.
Just for the damn waffle fries
No, you got chicken nuggets there once.
once.
Yeah.
Is that fast food?
I don't.
I guess.
They're faster than most of the fast food restaurants.
Well, I don't know.
Yeah, that's. But it's.
I'm talking about the greasy ass
Oh, yeah.
burgers and, like, sorry, McDonald's, Burger King, Taco Bell, KFC,
But it's weird because one night, this was a while ago, you actually said you were in the mood for KFC.
Yeah, but I wouldn't eat it.
And there's not one around, so it didn't matter. But
No, I can go get my own chicken, batter it, fry it, and then I'm fine. Eating from those places, I don't trust them.
yeah, I mean, and I get that.
And cutting out fast food in the grand scheme of things is
Healthy, so
like that and soda. I don't drink iced tea. I don't drink tea at all.
no.
I mean, I literally drink water and milk. Occasionally, got sick, drink Gatorade just to keep hydrated or whatever, or get some electrolytes. But for the most part, I don't drink juice or anything else.
You drink apple juice.
And I haven't had that in
Yeah.
5 months. But
The water just started too. Like you weren't even drinking water for the longest time.
that started when we got together.
Yeah.
Because I never drank water. The only water to me, drinking water was when you worked out or you were, you're sweating or whatever, which most people tell you by the time you're sweating, it's
Too
too
late.
late. But yeah, it was just a progression of cutting things out. Like if I'd have went somewhere, depending on what I ate, and then had some issues the next day or the day after, never went back. Like if we out at a restaurant or something.
And you're still like that today.
Oh yeah. Not so much. Well, okay. I mean, if you want to go right back to February, that was a little different because that was food poisoning or some shithead didn't know how to handle it correctly because we got a burger from not a fast food place, a regular restaurant, and then within a couple of hours, I was feeling like shit, and then by the morning, I was throwing up.
Now, just for the record, I also had a burger from the same place and I was fine, which kind of, we thought maybe he got like a GI bug, but
No, it was, I literally threw up 4 times in 5 hours.
yeah, something like
And
that.
that was it. So I've had stomach bugs before, and I'm throwing up for a day and a half or whatever.
Now, the last stomach bug I had I'll never forget it. It was a Friday. I remember it like clockwork. I came home from work and I was just like, it was Friday. I was tired. By 6 o'clock, I was in the bathroom and it was done. I was vomiting. I got done vomiting by 3 in the morning. Like it was done. Your body felt like crap afterwards, but I wasn't vomiting anymore.
And that was the thing with me. I felt perfectly fine. Like, I had thrown up twice, fell asleep for a couple hours, woke up, literally threw up twice again, and then went back to sleep. And then when I woke up, I felt perfectly fine.
That's why that food poisoning normally you have.
I'm not saying food poisoning, but whatever it was just didn't agree with me.
Right, yeah.
Or it was just mishandled or whatever it was, not cooked properly. I don't know.
Right.
Whatever you want to call it. Not flat out food poisoning where you're sick for 3 or 4 days and you're all fucked up. No, but I've had that before from eating at places where you go home and within a couple hours you just kind of like throw up or hit the toilet once and then you're fine. That's kind of what that was. But because of my what if thinking and worrying about everything, I haven't had ground beef since.
Correct.
And I've only had chicken. We made chicken here once, and you had chicken that we ordered out from
Twice.
that I had gotten raviolis from an Italian restaurant and had some of it. So it's only 3 times that I've had meat since, besides the lunch meat turkey, which is a couple of times. But now I'm worried about, well, is there something with the ground beef that my body can't handle? Which, no, that's not the case because it was one time, and until I eat it again and don't have a problem, it's going to be a problem.
Right.
And I know it sounds psychotic, but try living that way. And that's with a lot of things. There's been times where I've cooked here and just something didn't look right, or something popped into my head, or I got an odor of something, and then I'm not eating. And you eat it, and it's like, it's not stopping you from eating it, but I'm not. Because to me, it's like, well, I'm not going to sit here and worry for the next 4 or 5 hours.
We just had an incident when we got pizza. And it to me tasted salty. To you, it tasted.
I didn't know if there was like Parmesan cheese on it, or it was salty, or it just tasted off.
So to me, it just tasted salty.
I instantly go to, there's something wrong with it. And by the time I thought about it, I was already 3 slices in, and it's a little late at that point.
Now, we were out that night. We were out for the 4 hours. So, because all he kept thinking is, now I got to wait for 4 hours to see if I'm going to get sick. Now, and he didn't. He didn't. And I can usually tell if food isn't right. My stomach's horrible, so I can usually tell if something's off. But I said to him, I was like, it just tasted salty. I am not a salt person, so I can pick up salt like that. Like, I don't put salt on anything. Like, people that put salt on pizza should be shot. People that put salt on anything should be shot. And he was fine, and
but I mean, there's plenty of times. I mean, there's more often than not, if we eat out, or when we ate out, or if I cook something, I'll still, even before that incident, would kind of look at the clock and then, I'm good. And that would be, if we weren't out driving around, or we weren't actively doing something, it would let me think of, am I going to get sick? And which again, that's the first time I've gotten sick at like throwing up. I don't even know if I was like, I'm trying to think if I even had a stomach bug since I moved back to my mom's in 2009.
The only other time I knew that you threw up was in the hospital.
Well, that was throwing up blood that was in my stomach
Yeah,
from
that's
the
the only.
surgery.
I don't know any other time.
I'm just talking about getting a stomach bug or something from just something not agreeing with you.
Yeah, I don't.
Before that, I mean, it could have been 15 years, 20 years. I don't know.
All right. So besides the food, what if?
But that, and again, that's why I don't eat over people's houses. Even if we do go somewhere and somebody has like a buffet style thing or it's catered or whatever, you won't see me eating it. I've gotten to the point now where if you or I haven't cooked it, or it's not from a place that we've gone to for the past 10 years or
Right.
whatever, it's not happening. I just,
Now, aside from the food, what do you think would probably be your biggest what if concern? I mean, obviously, food's the top ranked, but
probably something happened to you.
you mean like something detrimental? Something's always happening to me, so I just wanted to make this clearer.
Yes, death would be detrimental.
Is that what you meant? Like the whole? Is that what
Yeah,
you? Yeah.
something like that happening or whatever. Yeah, like because at this point, that would be like I don't know what to compare it to. That would just be taking like 90% of my world away. Like, and having that kind of a hole, I'm not sure.
I get that.
Because I lean on you for so much as far as, especially the medical side of it, and not just because you're a medical professional, but because of you understanding and, being able to get me through that stuff. So I instantly would start thinking like, take away the obvious part. Don't think that I'm like worrying about myself. Like, how am I going to get this done? No, I mean, besides the grief and all of that, like, how would I get any of that done? How would I get, like, if I needed a surgery, what? It's not happening. I'm just going to die.
How would you've gotten through it before?
I don't know. Didn't happen.
The surgery didn't happen, right? I mean,
Nothing. I never had any, all my major injuries were prior to 93.
okay.
I, a dislocated finger and, cracked ribs or something like that. But everything else was 2017 on as far as surgery and, this, that little spot of skin cancer or whatever, and then the blood disorder, which the skin cancer, it's been there, it's been there at least 15 or 20 years. It wasn't diagnosed until 19 or 20. But I could care less. Like, I don't even think about that. And most people would be like, oh crap, I got cancer. And I'm like, yeah, I don't care. Like, that's the least of my problems. I got to get other shit done first. And even a blood disorder, that's just more of an annoyance of having to go out there because the entire hospital system in our area closed its doors one day and shut down 4 hospitals within a couple of years. So now it's a 30-plus minute ride out to
The other one's open.
well,
this week. But yeah, I get, yeah, it's still,
but it was just a pain. It wasn't like, oh no, what? It was more or less like, great, now I got to drive the fuck all the way out there instead of, you know, 7 or 8 minutes from my house to get treatment. So now I got to drive out there and start over with a bunch of new people and dealing with all that crap. So and you know, yeah, the blood disorder could, you know, it could advance to leukemia at some point.
at your age, is highly unlikely though now.
Right. I mean, it's well, actually, as the longer you have it, the greater chance you have of it turning to leukemia. But again, I don't ever think about it unless we're literally talking about it. Like I don't, which is weird because you would think you might be worried about getting leukemia, or you'd be worried about skin cancer, or you're worried about a blood clot, and I don't care about any of them.
I don't think so because I have the
I'm saying with somebody like who worries about the stupidest shit like me, stuff like that I could care less about. Stuff that could legitimately screw me up or, you know, kill me, I'm not concerned with.
I don't think it's that you're not concerned with it, or is no. I think because you mentioned a lot, so obviously there's a concern for it. But I'm saying,
No, I don't mention it a lot.
and sure, like when we talk about like what you need to do and stuff like that. But I'm saying, I think the skin cancer is the fact of the treatment for it. I think that worries you more than the cancer itself.
No, it's just the idiots won't. The ones that I was dealing with weren't understanding the panic disorder.
I I get what you're saying, but the treatment would still be the same.
No, actually, it's not. We found that out later, but I'm not going back to that facility because I'm not dealing with those doctors. I did have a doctor tell me that they could have, instead of just cutting it out, have you sit for 5 hours and wait for them to test the outer tissue to make sure they got it all and leave you with an open wound, which that, you know, leaving me sit there with an open wound. And then if I want to go home, I can't. Like, that's not happening. And then somebody else said we could just keep biopsying it until we've gotten it all. And I'm like, well, they should have told me that before, right? Because I'm not coming back now.
Okay, I get what he's saying, but I mean, typically that wouldn't. Now, there's also where they can actually take you into an OR and actually do it in one shot, but it's not typical. It would kind of like getting put to sleep to have a teeth cleaning done.
Never gave that option. They didn't give me, they gave me one option. And I went, and the thing that pissed me off was they got mad because I wasn't able to do it. They got pissed off. And I'm like, you ain't fucking understanding my situation at all. You're not even trying to understand
Yeah,
it.
and I don't know why they told you 5 hours.
Because, I don't know.
Yeah, that's.
And that facility is more geared towards jackasses who want a nose job or duck lips or a boob job or whatever. They're geared more towards the cosmetic stuff.
And they don't do any of that. The duck lips I'll give you, but they wouldn't do any of the other stuff.
Well, I'm just saying they're geared more towards. It's like certain dentists who are more geared towards just whitening and veneers as opposed to cavities and extract. You know,
Yeah, I don't.
they're more worried about people who want to just look good, not be healthy. But anyway.
Yeah, I've never seen any of them, so I don't know. But yeah, I get that like these are things that aren't you're not dwelling on, but like
I don't dwell on the blood disorder at all until I have to go deal with an appointment and have my numbers checked. Which half the time I just wait until I go to my doctor's and they want to do blood work, and then
unless you're having symptoms of something, yeah.
and then I can check and go, huh, I don't need to go to the hematologist. My numbers are fine because now I know what to look for.
Like I said, unless you're having symptoms, but yeah, I mean, I get that. And it's like anything else. If it's something that you're living with, you tend to, it gets put on the back burner.
Well, and also, I've gotten asked a lot, like, how do you live like that? Well, what's the alternative? I can reach out for help constantly, but that gets old after a while when you can't get anything. You're not getting anywhere, especially me with no patience, my frustration level, you know.
And I think that's part of it. I think if you were, and I'm not saying it's your fault, but I think if you were the type of person that would call once a week, hey, what's the status? What's the status? Because you are one patient to them where they have how many patients calling in.
Yeah, but I shouldn't have to fucking do that. I shouldn't have to drag them by their necks to do their job.
I'm not saying you have to drag them, but
And
cancellations, yes, they may have, and I tell people this all the time. If you're trying to get in with the doctor and they're telling you it's such and such a wait, call once a week. Any cancellations, because they may have a cancellation and they're not sitting here thinking, oh, we need to call Brian.
yeah, that's just not me.
And I understand that, but I'm saying
I look at it as, you motherfuckers make enough money, try actually doing your job. Like, I'm not going to do it for you.
they are doing their job, but you're one patient of how many?
Again, you're making my point for me.
I'm not.
I'm one patient. That doesn't matter.
I'm not saying you don't matter. I'm saying your name is not on the front of their mind 24 hours.
It should be. As far as I'm concerned, it should be.
And that's not realistic.
Everybody should feel that way about their own health.
And it's not real. And that's what I'm saying. I get that, but it's not realistic.
And every time you do call an office and ask them something, they act like you're wasting my, like I have better things to do than answer your questions. Well, fuck you. This is your job.
Are you talking to the same person?
I don't know.
So that's the other thing. Like,
I don't get their names, and if it's I don't have to worry about my primary care doctor because everybody there is great, and I do know them, and they know. Oh, hey, they know me, and it's not an issue. Other places, it's just, I'm just not going to. Maybe that's my own damn fault. I don't know. But to have to go to that extreme just to get a fucking appointment is insane to me. And I've dealt with places that we're going to put you on a cancellation list. So if anybody does, we'll call you. In 6 months, not one person canceled? Bullshit.
Now, here's my issue with the cancellation list. If you have 3 people working in that office, all 3 people ain't looking at the damn cancellation list. And I say that to them all the time when I call. Like, what's your policy for the cancellation list?
Well, then somebody's not doing their fucking job.
So, well, it's a little difficult because you aren't already an established patient either, which makes it a lot easier.
Then don't tell me you're going to put me on a list if you're not even going to ever look at the list.
And you'll be on the list, but if they have an established patient, most offices, it would go to them first.
Yeah, that was 3 years that we're talking about that one particular office.
But they did call you.
Every 6 months. No.
Yes.
Oh, yeah, they were sending me out of state where my insurance, it doesn't cover it. What good is that doing it?
Or they were going to bring you in at a time that wasn't feasible for you.
The only time that they ever called, they were sending me out of state. They never called for anywhere.
I thought they called for the Navy Yard at like 2 p.m.
Nope. I would have went.
No, you wouldn't have. At 2 p.m?
I would have been in and out of there. I would have never hit any traffic or anything.
I've gone at 3 o'clock. It's a pain in the ass down there. But I mean, and the only reason I find it odd is because we've called the same facilities.
Okay. I don't know what you're saying to them. and I tell you exactly what I said to them, and you've called facilities and said they're taking patients, they're taking your insurance, you're good to go. And then when I call them, it's a totally different story. Oh, no, we don't take that insurance. Or we're not accepting new patients. Or so, and I've had like sheets of paper with everybody on it, and nope, nope, nope. It wasn't even until the last 6 months that it kind of opened up to where there was more places that were taking the insurance and taking new patients.
Well, I did have the one.
And I'm still on a wait list for one that was supposed to be 2 months. We're now into 4 months.
I did have the one that would have been able to see you, but the times wouldn't work. That was the only one that I knew of. The one that they were willing to see you, but the times would not work. They wanted to see you, but like
That was the only time they could see me was 5 in the afternoon.
something like
somewhere where I was like, that's another thing. I'm not traveling during rush hour. So if it's between like 7 and 9 or whatever.
yeah, I think it was like 4:30. They were willing to see you or
yeah,
something.
and from 4 to 6, kiss my ass. I'm not doing it. I don't do traffic. There's no point making the appointment because I won't be there. And I'll just be wasting their time. And I try not to do that.
Yeah, I mean,
But, and a lot of the what if thinking keeps me from getting to these appointments.
right.
Or even making them. Am I going to be, what's my sleep schedule? My sleep schedule's all over the place. You go from sleeping from midnight till 8 to 4 in the morning till noon till 2 in the afternoon till 1 in the morning. You're like, I'm all over the place. So, I mean, yeah, trust me, this is when, like, if you watch any of the prior episodes, when I say that the panic disorder causes physical problems, I don't mean that it's literally caused like ulcers or anything like that. But it keeps me from getting to, regular, like dentistry or dermatology or whoever, and having regular hands-on examinations or testing, especially now that I'm 56. And, so, and I've swore, since I was in my 30s that, panic disorder won't be on my death certificate, but it'll be the cause of death because I couldn't get to do, get somewhere to get the treatment, or
Because of the panic disorder.
If I ever did get cancer, I'm just going to die of it. I'm not doing the chemo or the radiation. There's no way I would be able to do that.
It depends the type of cancer it was and what they were. It depends what.
I'm just saying,
in general, yeah.
say the blood disorder turned to leukemia. I know what the treatments for that is, and I'm not doing it.
It would depend what type of leukemia it turned to, but I get what you're saying. Yeah, I mean, not all.
I know not everything is hair falling out, chemo, and throwing up, and diarrhea, radiation, and all that. I know it's not all that, but I'm not going through any of it.
Radiation's probably one of the easier ones.
It just wipes you out. Well, from what I've been told.
Now, I know. I worked with a nurse who had breast cancer, and she worked during. The only time she wasn't able to work was her chemo week.
Sorry, bad hair day.
But she worked during radiation and all that. So, I mean, now the older you are, it gets a little tougher.
That also depends on the person.
Correct.
You could do that. I couldn't. You could fight through it. I wouldn't.
You just summed it up now. It's not that you couldn't, you wouldn't. You wouldn't even make the attempt to.
It's not even the attempt to. It's you're piling on top of everything else. I'm barely functioning as with what I have now. You pile something on top of it. I'm I won't name them, but my cousin just had to go through a really crappy procedure and all of that. And he was back to work waiting to have the procedure reversed.
Mm-hmm.
And then, that, not me. I wouldn't have been able to get through that. And I know people are like, you don't have a choice. You get, okay, I'll get through it, but not like that.
Right.
I would have shut down, been in total depression, not doing anything, not, you know, sitting in my room staring at TV or my phone for 4 or 5 months.
I don't think you really know what'll happen until it happens, because if somebody would have told you 9 years ago, you're going to need to have your appendix taken out, what would your answer have been?
Good luck with that.
And guess what?
Because of you.
Whatever the case is, you were still able to get through it.
No, because I honestly believe if I was there by myself, I would have left. I would have went home, and I would have died in my sleep. Because my appendix would have ruptured.
Oh, it would.
I wouldn't have known it.
Oh, yeah, it would have woke you up. But yeah, but I get what you're saying.
By that time, it would have been too late. Like, I wouldn't even have called 911 or anything. I would have just, because I wasn't having any symptoms. So whatever happened, it'd just be like, pulled a damn muscle.
Oh, you would have spiked the fever and all that. But yeah, I get what you're saying. But even, you've gone to the ER by yourself before.
For dumb shit, not for anything major. And most of the times it was completely unwarranted. And what times? I don't even. I went there literally because, and this came from the doctor who did the surgery from the appendicitis, that I probably had appendicitis off. What do you call it? Acute appendicitis?
No, we call it chronic.
Chronic, off and on for probably 5 years, because I had been there in 2012 because I thought I had a hernia or something. And they didn't find anything. Now, they didn't do a scan either. They may have found it then. Yeah, I mean, going through life worrying about shit that's, like this stuff with the estate. There's a real good thing of worrying about something that's completely out of your control and it's going to take years to resolve. And it was just a nonstop, get this the fuck over with already. I don't care anymore.
And that's what I said earlier. You need to be in control.
I'm not as much of a control freak now as I used to be.
No, I'm not saying a control freak, but you need to be able to, maybe being in control isn't the right thing, but you need to have a plan in case something happens.
I need an exit strategy for everything.
Yeah.
Doesn't matter what we're doing, I make sure that I have an exit strategy.
Yeah. So, I mean, all that makes sense coming into the big picture. It's just over the years,
Right now, the thing that worries me the most is the food situation and, like, how much more stuff is either going to get cut out, done away with, or the food is that going to start again to where I'm just cutting stuff out left and right and then I'm not eating, and then that starts, malnutrition issues. And, I know you're not going to let that happen and get to that point, but, it's still in my head that that's all a possibility, as is, anything's a possibility. But
the only thing you would have to cut out would be eating from that place. Because we know that.
Well, I don't know that, because in my mind and what I'm again, I hate to put it this way, it's hard to explain. I can sit there and I'm cooking chicken. There's absolutely nothing wrong with it. But it gets in my head that there could be, but I know there's not. But there could be, so I'm not eating it. even though there's nothing wrong with it. Like that's the I'll go back and forth for 10 minutes in my head like that and then just go, you know what? I'm not eating it because that way I know I'm definitely not going to get sick if I don't eat it. So and that goes along with anything. I'm not going to have a panic attack if I don't go do this. So it's safer for me to just not go do it, even though I'm probably not going to have a panic attack.
Then how can you drive?
Never had a problem with driving. Driving was a way of dealing with the panic attacks, not having them. And I know most people that have panic attacks have them in the car. Like a lot of people have them driving, and I'm like, driving is not.
And you don't have control.
I'm driving the car.
You have control of your vehicle. You don't have
Right.
control of somebody coming at you head on or sideswiping you. So that's where.
I didn't say any of this stuff makes sense.
No, I get that, but I'm saying that's why I'm thinking chemical. That's why I'm thinking that
Well, all mental
something's firing off when it shouldn't be, and
well, they don't know,
right,
and they're never going to know. If they don't know by now, they're not going to. They've been studying mental health and brains post-mortem and everything else.
Oh no, they know bipolar is a chemical imbalance.
But every mental illness is a chemical imbalance.
So what are you saying they don't know? I'm confused.
Because they're just saying it's a chemical imbalance. They don't know that.
They do because
How?
that's how the medication helps treat it.
Yeah, I don't buy it.
Do you know anyone who has bipolar? Diagnosed bipolar.
No. Self-diagnosed, there's a few, but
Okay,
no.
so
Just because you give somebody medicine and it straightens them out, that automatically means it's a chemical imbalance?
the medication that they're being so here, all right, so with
Because I've gotten real conflicting information from doctors over, because I asked in the beginning, I was like, why can't I get a brain scan? Well, the only way they're doing that is if you're dead. And I'm like, no,
that's not.
I'm like, I've seen them where they're sitting there and they start doing different stimuli and you see
They'll show you a picture
on the
and it'll
screen and it's firing off in different colors.
Okay, so let me ask you this. We're going to go back. Who did you ask?
A primary care doctor.
Okay.
Yes, he retired and became an archaeologist who plays with Barbies.
Okay.
He went nuts.
So I'm not trying to.
He may have been fine at the time, though.
I don't think so. So here's the thing.
This is the medical care I've been dealing with, so that might explain everything.
So here's it has gotten better since we've been together, though.
Oh, my primary care now, I wouldn't trade her for the world.
So
like if she told me she was retiring, I would start crying.
You're welcome. So here's my thing. Yes, there is a scan that they can do to see where you're firing off. There is a
But it's probably so expensive that there's no way that the insurance is going to cover it.
No, not really. That's not the case. That's not the reason why. The problem is,
well, they're shoving radiation into your brain.
Yes, so
unnecessarily, probably.
Right. So is the
yeah, but you know what? I would rather at this age, I'll take my chances with the radiation as opposed to trying 30 different medications to see which one's going to work. Because whoever that person is that's bipolar, it wasn't the first medication they gave them. I'll almost bet my you-know-what on it that it was not the first one. Because they don't know what to give you. They have this worked on so many people.
No, it has to do with your age, your sex, how often you're going manic, how often you're...
Okay, so in the beginning with the panic disorder, I had been given 6 or 7 different medications to try. Okay, try. That was the key word. We don't know if this is going to work. We're going to try it out.
Because they were not sure what they were treating.
Well, then shouldn't you be sure before you start treating it?
But, and the flip side is you did not give the medicine a long enough time to kick in.
Whoa. No, they didn't. They took me off of it.
Okay, because
They were overdosing or giving me whatever you want to call it, a larger dose than they should have been starting me out at,
so
and it was causing problems.
all psych meds, no different than any GERD medication. It takes 14 days for it to hit therapeutic level where you're going to see significant changes. The problem is, I'll make this real easy. Anyone who's ever been on any acne medicine, what happens when you first use the acne medicine?
Makes it worse.
Everything comes out and then it'll clear it up. Same way a lot of times with other medications, you have to get, and the problem is you get drowsy. You don't feel good. You may have this, you may have that. You're not letting it get to the point.
I'm okay with the drowsy or feeling run down. But when you go into like a paralysis state and everything is yellow and the ER is telling you stop. They overdosed you. Stop taking it.
And
okay, well, I'm not going to take it again.
so, I get
Even
that.
at a lower dose, I'm not going to.
I get that. So typically, yes, all psych meds is they start you at a lower dose and they taper you up. The same way when you go to get off of it, you have to taper down in order to stop it.
Right. But again, they're guessing. They're going by what has worked the best that they've seen with similar patients, which doesn't mean shit. It's an educated guess. That's all it is. And that's pretty much what psychiatry is. It's an educated guess.
No different than your GERD medicine.
They know what's causing it.
They don't know what's firing off to cause it, though. That is why sometimes Nexium works. Sometimes, hold on. And upper GI is not going to tell you if that's what you're going to say.
No.
So sometimes Nexium works. Sometimes Pepcid works. Sometimes Prevacid works.
But if you tell them every time you eat something tomato-based, that's when it happens.
It's still no, that doesn't have anything to do with where it's firing off in your stomach.
Okay, but I'll try a Pepcid or
Nexium,
Omeprazole, whatever
yeah.
the other ones are. The side effects from them are almost zero.
Usually, yes. Or the same way with
Well, and psych med's got a ton of side effects.
the same way with high blood pressure. They can turn around and say, all right, we're going to give you Diavan and your blood pressure's still through the roof. All right, well, Diavan's not quite working. So what is causing the blood pressure problems?
Probably your diet.
So a lot of people, it's stress, it's lifestyle, it's not just diet, but so and I get it. Medication.
Trust me, if they could, if I was diagnosed with high blood pressure and they said your salt intake has to come way down. Salt's out. Same way as if they told me, okay, your panic disorder is due to watching YouTube. Well, I just stop watching YouTube.
So your panic disorder is due to you drinking milk.
I'd stop drinking milk. If that was going to get rid of the panic disorder,
I don't know if you'd be able to.
I'd stop drinking in a heartbeat. To be able to be normal again? Oh, I don't care.
So why didn't you cut it out with the GI issues?
If they told me they could cut off my left leg and the panic disorder and the what if thinking and all that stuff would be gone, go ahead.
So
I would go the next day.
So with all the GI issues you had, why didn't you cut milk out?
I don't know. Now, I did change it from like whole milk to 2% to now 1%, which I can't even drink whole milk anymore. Like if I even take a sip, it just tastes like I'm drinking heavy cream. And there's people that are like 1%, it's like water. And I'm like, but that was something that I actually did because I used to drink half a gallon a day.
Yeah, and that's one thing I can't do. I can't drink milk. I can eat cheese like it's my job, but
and that's why I went down to the 2% and then to the 1%.
Did you ever drink skim?
No, I'm not going there.
Why?
I'll just put some white dye in water and call it a day. No. The 1%'s low enough.
Yeah, I mean, I get what you're saying about the medication.
But again, if a doctor said you stop, because when we thought there was a chance that with the itching and all that before the blood disorder, what the hell's that shit called? The allergy? The wheat allergy?
Oh, gluten.
Gluten allergy. What's the actual medical?
Celiac disease.
Celiac. So I stopped that for a month. Like I was eating burgers with no roll and, whatever, no pasta, nothing. And I'll be honest with you, I was fine with that. I didn't care. You see me, like when we went out, I need just give me 2 cheeseburgers with no roll.
Right.
Put the cheese and the pickles and that stuff on it or whatever, but just no roll or, I just didn't get anything. We didn't eat out all that often for that month.
We were cooking here a lot.
But it wasn't that big of an issue. I have no problem cutting that stuff out. As long as there's an actual result. If you're cutting it out, just, if there's going to be a result, fine. If not, then...
What's the sense?
You want to try cutting it out for a month? No milk and cookies? Yeah, I'm 56. I have milk and cookies every day. Sometimes twice. Excuse me, and way more than I should.
And it's crazy because it's rare that I'll eat cookies. I don't eat cookies very often at all.
You'll steal a couple of mine here and there, but that's very rare.
And I don't drink milk at all. Like, I don't even eat cereal because you have to put milk in cereal.
Yeah, but like I said, if you got to cut off my left arm, I'd rather it wasn't the right one.
So,
but if they said that'll cure all your mental illness,
and what if they said you can take this pill and you would be done? It would all be gone. Would you take the pill?
Guaranteed?
Uh-huh.
What are the side effects? And how long do they last? Because this people have posed this question. They're like, at the time where I would not cross bridges, they were like, "What if somebody put $5 million on the other side of that bridge?" I'm like, "Well, somebody else is going to get it because
that's not realistic though, because you don't have the $5 million now. You're not gaining nothing."
But I'm saying, that $5 million would cure a lot of problems. Because now I could go get health care from doctors who are really good, but they either want really good insurance or cash. They're not taking a crappy insurance. So I'm just saying, when you put it like that, it's like, no, at that time, now, I don't have a problem crossing bridges or going up elevators. It's not that big of a deal. At rush hour, no, I still won't do it.
So if they told you can take this pill,
and again, you just heard me come up with a bunch of what are the side effects, how long are they going to last, is it going to be I'm going to feel like crap for 24 hours and then everything's fine, and that's
it'll take your body a week to get used to it.
How? What are the side effects?
You would be...
We talking diarrhea, throwing up?
No.
Just feel like crap?
Yeah, you may have some...
Fine.
You may have some where you very run down, sleepy.
I don't even know if I'd be able to tell. That I don't care about.
And you may have incontinence issues for a week. Urine incontinence.
I know what that is. Fine, I could stay in the house for a week. I could stay in the house for months.
So
that don't bother me. That's one thing I can do. I could do the hibernation and it wouldn't affect me at all.
I know when you get medication, you read what the side effects are.
I've stopped doing that since we've been together because
every medication,
they all go,
nausea, vomiting, diarrhea.
They go from headache to death and everything in between. So it's like, you know what? They're putting that shit on there to cover their own ass
No, it's
so
because
they
it's
don't get
happened to.
sued.
And here's the problem with it: if it's happened to one person, they have to put it on there. Now, you could have had a GI bug when you took the pill, and that's why you were vomiting. Had nothing to do with the pill, but still.
I think they put it on there just so they can't get sued. Or if
And
they do get sued, they can go, we put it right there. If they didn't read it, not our fault. Because you watch all the new Ozempics and all that stuff and the biologics. Side effects: nausea, diarrhea, vomiting, suicidal thoughts, death, leukemia,
hold on.
parasitic infections. And it's like, how do you get a parasitic infection from a pill?
So hold on. I want to get one better. Ozempic, Wegovy, all of them. One of the things it says is
Weight loss.
no. Metrological thyroid cancer.
That was my other thing. How does it cause cancer?
Hold on. It's never caused cancer in a human being. It was in the mice trial. But they put it on there because they've had patients that had a nodule on their thyroid, started taking it somewhere down the line. That nodule turned cancerous. They had the nodule before they went on the medication. So that's.
I mean, the stuff was probably going to go in there anyway because of lawyers, so they don't get sued. Or if they do, they can.
It's an insulin though, so why? That. But I see what you're saying. But I just think.
Yeah. If there's a medication that I need for some reason, yeah, I don't read the side effects because. But doctors will tell you you need to be aware of them. And I'm like, well, if you make me aware of certain ones, I'm not going to take it.
But that's every medication.
How many medications you see me take?
No, I understand that. But if I look up the side effects for the meds you're on, they're in there. They're listed as common side effects.
And I've been on them for a long time without those problems.
That's what I'm saying.
But if you give me a new one, nope.
That's what I'm saying. So that whole that's
I forget what they tried to start me on. It may have been the Ativan prior to the surgery, before we got together.
It was.
They were like,
dipshit was going to give it to you.
And like I had the pill in my hand. I was like, can't do it, and just threw them out. Even though it's in the same family, probably wouldn't have been an issue, but I wasn't willing to take the chance on having a problem.
Would you now, since you've had it?
I've had it IV. I haven't had it pill form.
They gave it to you pill form before you left the hospital.
Says you. I don't remember that.
Yeah, it was the last. So right before we left, they gave you the Ativan, and I believe they gave you probably Tramadol.
I don't remember none of that.
Well, I knew it wasn't Dilaudid or nothing like that pill form, so it was probably Tramadol for pain.
I don't know.
But, all right. So, I mean, I get the what if thinking being difficult, and I think we're going to end here with that what if thinking in the next episode. What do you want to cover in the next episode?
I'm sure we'll come up with something. There's plenty of issues. We'll figure it out.
Yeah, I'll have my mind going into overdrive trying to figure it out for you.
It won't take that long.
All right, guys. We will see you on the next episode. Have a good one.